it incredible to think about how much data and information we interact with on a daily basis, and how much data we share in so many dimensions of our lives? But on the flip side, is it really clear to us how all this data sharing is creating positive impact for us? What if instead we shifted our focus of data sharing on enhancing and advancing our collective and individual well-being? All of us have been on the computer. Maybe we're even trying to get a little bit of work done, when suddenly we get distracted with a product or maybe some content, and we start clicking away. We accept these intrusions. Sometimes we even submit to them. And through all those clicks and clacks, our data is being aggregated. It's aggregated and it's sold to third parties, who then use it to sell us more products, introduce us to more content. Some even use this data to create good, maybe important societal insights, like how zip codes might be connected to differences in life expectancy, or where we might have food deserts that we need to do something about. In healthcare, we use data and information all the time. We use it to help uncover patterns that patients might need us to help solve for them in terms of their illnesses or challenges. At the heart of a physician's training is this ability to bring data together and uncover patterns. Symptoms, 1, 2, 3, plus physical exam findings, A and B, and test results, X, Y, Z, they create a picture, an important insight to what might be happening for that individual patient. When we bring data together to form patterns and insights, the impact isn't just for individuals. It can also be transformative when it's applied to groups or populations. One system really began to think about how to use these data and insights to create an early warning system that might help teams understand which patients might be in trouble. Because if they understood who was in trouble, maybe they could prevent a really bad event, like a cardiac arrest. In one health system, when this type of early warning system was implemented, many lives were saved. Data that was being collected all the time, the patient's vital signs, laboratory results, demographic information, was brought together every hour, and a score was generated. If the score was high, the patient was in trouble. If the score was low, the patient was not. And if the score was somewhere in the middle, the team needed to pay attention. Over the next couple of hours, the patient could either get better or they could get worse. This powerful data aggregation allowed the team to have a common language and perspective on that patient's situation. Interestingly, the data was there all along, but until it was brought together and connected to a team, it did not create this kind of impact. What kind of impact did it create? When this system was implemented, it resulted in the saving of 1 additional life a week. That's pretty amazing. Data plus purposeful teams equaled tremendous impact on well-being. Now, cardiac arrest is a pretty extreme example of well-being. It's about the dimension of being alive, which I think we would all say is pretty important. But there are other really important dimensions of well-being, like social isolation and loneliness. Could those benefit from bringing together data and teams? The National Academies of Science, Medicine, and Engineering have highlighted some really important information. 1/3 of individuals 45 and older experience loneliness, and 1/4 of adults 65 and older meet criteria for social isolation. Now, the inputs to help us understand those dimensions of well-being are really different than the inputs that we needed to understand risk of cardiac arrest. These inputs are more like things around social connection, gratitude, movement, nutrition. Each Each of us generates lots of data points around these dimensions of well-being as well. You might say, how? How about through our thoughts and actions every day? We generate many, many data points, and when we bring those together, they uncover incredibly important patterns that if we had access to, maybe we could act on. We don't typically have ways to easily share this kind of information, but what if we did? What if we could regularly share insights about our activities, our habits, our thoughts, and share them with a purposeful team, a group of people that wanted to support us and help us advance our well-being? Would we? Let's now think about what it would take to create that kind of purposeful team. What if we called that purposeful team a trusting community? And what if each day we shared many of the things we do every day and experience, the steps we walk, the thoughts we have, the moods we feel, the food we eat, the social connections we make, and so on? If we were to share those insights with a group of people, would they help us improve? Could we help each other improve? Would that allow us to radically give to one another more generously and proactively? Now, let's imagine that I'm a member of such one of those trusting communities. And let's imagine that Nina, a member of my trusting community, she might notice that Wednesdays are pretty tough for me. Maybe she could reach out to me on Tuesday, help me have a better Wednesday. And what if I, in turn, noticed that Ludia, another member of our trusting community, is eating dinner too many days in a row, all by herself? Could I reach out? I could invite her over for dinner, even if right now that dinner invitation was only by Zoom. While we think of data as large sets of de-identified information that someone else collects and uses for their own purpose, maybe a purpose that we don't understand, maybe a purpose we don't even agree with, couldn't we just flip that whole paradigm on its head? And what if instead we created and shared data sets with trusting communities? What would that do? That would allow the people who contribute and participate to benefit the most from the data that's shared. So as we think about this shift, this is less about technology. It's more about the practice of sharing, the information we share, and it's fundamentally about our willingness to be part of and participate in a trusting community. Now, as I think about that leap, it's pretty huge. It really asks us to believe that if a group of people had insights into our vulnerabilities, their instinct would be to reach out and want to help. Now, haven't all of us had a situation where maybe someone we care deeply about has had a really tough set of circumstances? And haven't we ever felt like, gosh, I wish I had known things were that tough? Why? Because if we had known, we would have done something. Frequently, the data and information was there all along. What was missing was the ability to create an insight and, most importantly, connect it to that trusting community. So, how do we begin? What trusting communities are we a part of already? Maybe we could lean into them. Would we be willing to maybe share information about our days with our book club, our walking group, maybe our faith community? Are there tools that exist already that would allow us to ask each other questions that maybe then we could submit our answers to, and then we could all see how each other's doing, use that information and reach out and support one another? Maybe those tools exist already. Maybe we could use SurveyMonkey or Typeform, just to name a couple. What if the TEDx community formed trusting communities? If we tested this idea, what would we learn? How would we grow as individuals and as groups? I say, let's begin.